Alright, so hello and namaste here. I'm Dr. Gaurang here and I'm going to talk to you about something very exciting that we are coming up with, that is treating homeopathic strategies in treating female disorders. And I just want to give you a brief idea about so many different clinical tips, clinical approaches. Just today we were discussing one of the most commonest remedies that we are using for this is folliculine or top sarcode. This is such an important remedy that we are using in complicated cases of infertility, polycystic ovarian diseases, endometriosis, and so many hormonal related problems. But how to use it? Because there are so many different sarcodes. There's another remedy, uforinum, also a sarcode. Another remedy, pituitary, anterior pituitary. How to use it? There is a posterior pituitary. How to use these different sarcodes? I'm going to talk about it gradually, but let me give you a little idea about folliculinum. One of the main things about folliculinum is, we'll start with the state of mind. It is somewhere between lac caninum and sepia, the state of folliculinum, which means one of the main feeling of folliculinum is feeling of being too much abused, dominated, which is also there actually in lac caninum. Lac caninum has a feeling of being dominated as also. In sepia, the idea is undertake things opposed to intention. But the idea of folliculinum is this constant feeling of being dominated, abused. If you open the repertory, abuse ailments from, abuse sexual ailments from, you'll see one of the important remedies, folliculinum. But the main feeling for folliculinum in this situation, and they often use this word, is I feel too much of pressure. Too much of under pressure, too much of feeling as if I have been pressurized. This is a very strong experience level symptom for folliculinum. The other thing that you will see with folliculinum is this kind of abuse, domination and pressurized experience causes the folliculinum patient to cause amenorrhea, cysts in the ovaries and many other hormonal related problems. And that's why folliculinum is a very important remedy for many young girls, young women with PCOD and infertility, and also in adults in climacteric kind of age group with so many symptoms of flushing, of dryness in their genitals, etc. The three important peculiarities that I want to tell you about folliculinum here is all symptoms are better during menses. Like lachesis, like zincum, like cyclamen. All symptoms are aggravated during the ovulation phase. I'll give you a very quick clinical tip. In many cases of infertility, along with the regular indicated medicine, on the 13 and 14 day during the ovulation phase, around that area, we often give folliculinum 31 dose. This improves the kind of quality of eggs. So this is an important clinical tip, especially for cases you're treating which are having infertility, and also women who come to us who are already taking IUI treatment, IVF treatment, and they want a better quality of egg to form. Homeopathy is very useful. So this is one symptom I want to tell you. The next important symptom is a lot of increased appetite before menses. Especially they want to have something starchy. This is very important for folliculinum. Also there in pulsatilla, also there in spongia. And last is they develop a lot of skin symptoms, especially acne before the menses. This is a little bit like magnesium. And also there in another remedy, sepia, and also in medullin. So this is a little bit clinical picture about folliculinum, how to clinically use it. You know that I have already written a book on materia medica of nosol, sarcodes and bowel nosol, but I want to come up with this very beautiful course that we have formulated, that is homeopathic strategies in gynecological disorders. What is this about? It's a 20 plus hours online course on just how to treat dysmenorrhea, PCOD, infertility, breast cancers, even post breast cancers, post chemotherapy cases, how to treat other gynecological problems like fibroadenoma of the breast, etc., etc., etc. Entire list of kind of topics that you will see at the end of this video. And we have homeopaths across the globe, the best ones joining us to teach. We have Dr. Sarkar, Dr. Amar Singh Nikam, we have Dr. Pradeep, Dr. Jappal, everyone. I will also be a part of it as well. And I also invited a gynecologist from allopathy to share about clinical differentiation, to guide their clinical ideas about how to differentiate and how homeopaths can actually upgrade their skill set. So this is a very, very phenomenal course. I will be joining not only as a teacher, as a part of the faculty of teaching, but also as a participant. I want to learn a lot as well. So I want to invite you for this course. You'll get all the details. There is a kind of a discounted offer right now for the next few days. You're right here on this email ID, and it would be great for us to have you with us. Thank you.